You've heard of concierge medicine, but doesn't it cost an arm and a leg? Isn't it really meant just for the 1%, the elite, the rich maybe? Well, no, it's not. And let me explain that more to you today. Hello, I'm Dr. Stephen Schimpff. This is part of a continuing series on the crisis in primary care. I described direct primary care in our last segment. In this one, I want to get into the costs a little bit more. But first, just a quick review. What's direct primary care? It is basically that the physician reduces the number of patients that they're caring for to from usually around 2,500 to 3,000 down to around 500. Could be fewer, could be more, but around that number. And because of that, they can now give the time that each patient needs, especially those people who have chronic illnesses, maybe around 3 to 7 prescription medications, those who have some hearing or some visual or cognitive decline with aging who need just some extra time. All of these can be taken care of now by that primary care physician. A lot more attention to health, wellness, prevention. The chronic illnesses can usually be dealt with by the primary care physician, so there's many fewer referrals to specialists. Turns out, because the doctor's just taking more time and listening, less need for testing, less need for x-rays sometimes, and the whole thing ends up costing less because there's fewer trips to the ER, fewer hospitalizations, fewer prescriptions. It really is much better care. That's the essence of it. But does it cost? Yes, it costs. It costs out of your pocket. That's the point of it. It's direct primary care. By the way, it can be called direct primary care. Some call it membership, and they have a monthly fee. Some call it retainer-based, and usually that means an annual fee, or concierge. Concierge has this sort of negative implication that it's very expensive. But let's just talk about expenses now. It really varies. In Manhattan, it would cost a lot more than it would, say, in rural western New York State. Those who call themselves direct primary care or membership usually do it on a monthly basis, and they might charge something like $40 for a younger person, $75 for an older person, the reason being that the older person probably has more chronic illnesses, and they'll package it for a family so it's not just, added up, but rather more of a comprehensive package. Now, on the other end of it, the retainer base, or what we might call concierge, might cost anywhere from, say, $1,500 to $2,000. So there's a range in there, but all of them doing approximately the same thing. More time for the individual, more time to give the types of care that I've described. Something else that many of these practices do is the doctor will buy medications wholesale, generic medications, and then sell them to you at the same cost, or maybe a very small markup. This can be a huge saving for someone who's on many different prescriptions. Same thing for testing and for x-rays. They make deals, if you will, with the local laboratory, and for a test that might cost $50 if you just went there directly, he can get it, or she can get it for you for $5. Why? Because they collect the $5 from you now, and they promise the laboratory they'll pay every month on the first of the month for sure. The laboratory realizes they've just gotten rid of a whole lot of their overhead costs, so it works out for them. So is it too much? Well, it's a matter of prioritization. I said anywhere from like $40 to $75 a month. Now, I bet you many of you watching have one of these, and you're paying something like that for your phone. You're paying maybe even more than that for your internet and TV. I'm not saying that the phone isn't important or the internet and TV isn't important, but it is really a question of prioritization. I think that's really the critical issue here. How much is your health care worth? Is it worth paying out of your pocket to get more? That's the question. Now, in the next segment, I want to talk about some other ways that it's possible to get better care.